Let me talk to you plainly. As a doctor who has spent more than 3 decades sitting across from patients, holding their hands, looking into their eyes, I've learned that there is one truth we cannot run from. Age brings change. Some of it is graceful, wisdom, patience, love that runs deeper than ever. But some of it is silent, dangerous, and far too often, deadly. Today, I want to speak to you with the seriousness this moment demands. If you are over 60 years old, your body is whispering things. Sometimes it screams, and ignoring those whispers or screams can cost you everything. I have seen too many people ignore the signs. Good, kind people who thought they were just tired, or that the pain would pass, or that the odd symptom meant nothing. But I'm telling you from a place of love and truth, if you ever feel any of the 6 symptoms I am about to share with you, I beg you, do not brush them off. Do not wait. Do not think you are being dramatic. These signs can be warnings, not just of illness, but of something much more final. When you feel them, death may not be far behind. The first warning sign is sudden chest discomfort. I'm not just talking about sharp pain like we often see in the movies. Sometimes it feels like pressure, a squeezing, a weight you can't shake off. Many seniors say it feels like an elephant sitting on their chest. Others describe it as discomfort that spreads into their neck, back, or arms. Let me be clear. Even if it is mild, even if it passes, if you feel this, you must act. The American Heart Association has shown that people over 60 who experience chest discomfort, especially those with diabetes, often have silent heart attacks. A 2012 study published in JAMA found that nearly half of heart attacks in older adults were unrecognized at the time they occurred. Think about that. Half. They walked around with a damaged heart, not knowing the danger they were in. Sometimes they survived, sometimes they didn't. Do not take the chance. If you feel pressure, pain, or tightness in your chest, even briefly, call emergency services. Every minute counts. Literally. Time is muscle. Every second without treatment, heart cells are dying. The second warning is unexplained shortness of breath. I know what you're thinking. You're older now. Maybe you've gained a few pounds. Maybe you're not as active. But if you are finding it suddenly difficult to breathe after climbing a few steps or even at rest, that is not just aging. It is not just getting older. It could be your heart or your lungs. A 2015 study in the New England Journal of Medicine found that nearly 70% of patients over 65 who reported sudden shortness of breath were later diagnosed with serious heart conditions like congestive heart failure or chronic obstructive pulmonary disease. Many of those patients had no previous diagnosis. Breath is life. When your breath becomes difficult, it is not just discomfort. It could be your body crying out for help. If you are gasping or feeling winded for no clear reason, don't wait. That struggle may be your final warning. The third sign that you must never ignore is sudden confusion or trouble speaking. I've seen the fear in families' eyes when a loved one suddenly becomes confused or starts slurring their words. One moment, they were fine. The next, they are asking strange questions or can't find the right words. This is often a sign of a stroke, and strokes do not wait. According to the National Institute of Neurological Disorders and Stroke, the window for treatment to prevent long-term damage or death is less than 3 hours. Every second, millions of brain cells die. And here's the tragedy. Many older adults ignore the signs because the symptoms pass quickly. But that is exactly what makes them dangerous. A transient ischemic attack, also known as a mini-stroke, can happen fast and leave no trace at first. But it is a massive red flag. Studies show that 1 in 3 people who have a mini-stroke will have a full-blown stroke within a year. You cannot afford to take that chance. If you feel confused, if your words won't come out, if your face droops or your arm feels weak, don't wait. Call for help immediately. The fourth sign is unexplained weight loss. I'm not talking about a pound or 2. I mean weight loss of more than 5% of your body weight over 6 to 12 months without trying. If you're not dieting, not exercising more than usual, and yet your clothes are looser, your belt tighter, something is wrong. It could be cancer, it could be diabetes, it could be a chronic infection. In older adults, unexplained weight loss is one of the strongest predictors of underlying illness. A 2008 study in the Annals of Internal Medicine found that unintentional weight loss in seniors was associated with a significantly increased risk of mortality. Cancer was the most common underlying cause, followed by gastrointestinal disorders and psychiatric illness. Do not think of weight loss as a blessing. When it is unexpected, it is a clue. Your body is trying to tell you something. Please listen to it. The fifth sign, and this one breaks my heart, it is severe or persistent fatigue. Not just feeling tired, we all feel tired sometimes. But if you wake up exhausted, if the simple act of brushing your teeth wears you out, if walking across the room feels like a mountain climb, that is not normal. It could be heart disease. It could be kidney failure. It could be cancer. Fatigue is one of the most common yet most overlooked symptoms in older adults. The Mayo Clinic has found that persistent fatigue in seniors is often the first sign of serious illness. The body is shutting down slowly, and it's asking for help. But so many people wave it off. They say, "I'm just getting old." Number aging does not mean losing all energy. You deserve to feel alive. When you don't, you need to ask why, and you need to ask now. The sixth and final warning sign is pain or discomfort in the abdomen that will not go away. I'm talking about the kind of pain that keeps coming back or lingers, even if it is dull. You might think it's indigestion, gas, maybe something you ate. But if you are over 60 and this pain is new, persistent, or worsening, you must get it checked. It could be something simple, but it could be something very serious. Pancreatic cancer, abdominal aortic aneurysm, colon cancer. These are not rare in older adults, and their first sign is often abdominal pain. A 2010 study in the British Journal of General Practice found that adults over 60 who reported persistent abdominal pain had a significantly increased risk of underlying malignancy, especially if associated with weight loss or changes in bowel habits. These conditions are not always caught early, but when they are, the chances of survival increase dramatically. The key is not waiting. Your body's not trying to scare you. It is trying to save you. You may wonder why I speak this way, why I speak so plainly. It's because I've watched people I care about ignore these very symptoms. I've watched them come in too late. Sometimes I had to look their spouse in the eye and say we did everything we could, and sometimes that everything wasn't enough. But I've also seen the other side. The patient who called when they felt strange pressure in their chest. The man who came in when his words slurred during breakfast. The woman who questioned her weight loss and caught her cancer early. They are alive today because they listened to their bodies, because they did not wait, because they understood that these 6 signs are not just symptoms, they are warnings. If you take anything from what I'm saying, let it be this. You matter. Your life is not less important because you are older. Your time is not over, but it can be cut short if you ignore the signals. You have loved ones. You have memories left to make. You have mornings yet to wake up to, but only if you listen. These 6 symptoms are not always loud. They may not come with drama or fanfare, but they are serious and they can be deadly. So if you feel a pressure in your chest, if your breath becomes hard to catch, if your words stumble or your thoughts scatter, if you lose weight without reason, if exhaustion clings to you like a fog, if your stomach aches in a way it never has before, do not wait. Do not second guess. Do not hope it will go away. Take it seriously. Call your doctor. Go to the hospital. Let someone help, because you deserve more time. You deserve health. You deserve to be here. And sometimes all it takes to save your life is listening. Listening to the signs, listening to your body, listening to your heart, and remembering this. Death is only near when we ignore what the body already knows. Do not let that happen to you. Are you listening to what your body is trying to tell you? Let me ask you something simple but powerful. Are you truly listening to what your body's trying to tell you? I don't mean once in a while. I don't mean after the pain becomes unbearable or when your family begs you to go to the doctor. I mean every day, every quiet moment, every strange twinge, every time you feel off and brush it aside. Because your body speaks to you in ways no test or scan ever fully can. And especially after 60, it speaks more often and with more urgency. The question is, are you paying attention? You see, after spending decades with patients, I've come to understand something that no textbook ever taught me. The body is not silent. It whispers, it warns, it remembers. The older we get, the more clearly it speaks. Not because it is failing, but because it knows. It has seen the stress we carry, the nights we didn't sleep, the meals we rushed, the years we spent putting others before ourselves. And it wants to protect us, but only if we let it. When I talk to my patients in their 60s and 70s, I often ask them how they've been feeling. And too often they smile and say, "Oh, it's just old age, doc." But the truth is, many of the signs they dismiss are the body's way of shouting that something deeper is going on. A study from the Journal of the American Medical Association in 2017 found that seniors frequently underreport symptoms like fatigue, chest discomfort, or cognitive decline. Not because they don't notice, but because they believe it's just part of aging. The problem is, when we do that, we give illness the time it needs to grow in silence. Think about the last time you felt pain that didn't seem right. Maybe it was a nagging ache in your side. Maybe it was dizziness that came and went. Maybe your memory felt a little foggier than usual. Did you stop and ask why? Or did you pour a cup of coffee and push through it? If you're like most people I've seen, you probably chose the second. I understand. It's hard to admit we need help, but I want you to know there is no strength in silence when it comes to your health. Strength is choosing to listen, choosing to act. Let me tell you about a man I treated some years ago. His name was George. He was 72, strong, proud. He had worked with his hands his entire life. When he came to see me, he mentioned he had been feeling more tired than usual. I asked him to explain. He shrugged it off, said he was just getting older, said he didn't want to waste my time, but something in his voice told me he was worried. I ordered a few simple tests, and what we found saved his life. George had early-stage leukemia. He had no pain, no bleeding, no obvious signs, just a quiet fatigue that wouldn't go away. Because he chose to speak up, because we listened to his body together, he started treatment early, and today he is alive, living, thriving, watching his grandchildren grow. This is not a story of luck. It's a story of listening. A 2019 study published in The Lancet found that early detection is one of the most critical factors in surviving chronic disease. That includes cancer, heart disease, kidney failure, even dementia. The earlier we listen, the more power we have. But it starts with a mindset shift. It starts with believing that your body's signals matter, that they are not just annoyances, they are messages, warnings, clues. You might be thinking, but I've had so many tests. They all come back fine. And that may be true, but even when tests look normal, your body might still be telling you something is off. A racing heart when you're not anxious, a sudden change in how your clothes fit, a new kind of headache, a shift in mood that lasts longer than a few days. These are not small things. They are your body waving a flag, asking for attention, and you owe it to yourself to respond. One of the most underestimated things I see in older patients is how emotional stress shows up physically. A study from Harvard in 2020 found that adults over 60 who reported chronic stress or loneliness had significantly higher rates of cardiovascular disease and cognitive decline. The mind and body are not separate. When your spirit feels heavy, your heart carries the load, and that weight over time becomes disease. Listening to your body also means listening to your emotions. When you feel down, when you feel forgotten, when joy slips away without reason, these are symptoms too, and they matter just as much. Another patient of mine, Maria, came in after feeling dizzy for a few days. She had been ignoring it, blamed it on standing up too quickly, but her body kept repeating the message. She finally came in. We ran a few tests, and it turned out her blood pressure was dangerously low because of a new medication interaction. If she had waited another day, she might have fainted, or worse. Again, it wasn't the symptom that saved her. It was her decision to stop ignoring it. That decision saved her life. Listening is not about being afraid. It is about being aware. Aware that your life is valuable, that your time matters, that your health is not something to take for granted, especially after 60, when the risks increase. The Centers for Disease Control reports that 80% of adults over 65 have at least one chronic health condition. But many of those conditions are manageable when caught early. The key is paying attention. So I ask you again, are you listening? When your hands tremble, when your heartbeat changes, when you can't sleep or eat the way you used to, are you stopping to ask why? Are you honoring what your body's telling you? Or are you brushing it aside, thinking it will go away? I say this because I care, because too many lives have been lost to silence, and because every time I hear someone say, "I wish I had come in sooner," it breaks something in me. Your body is not your enemy. It is your most loyal companion. It fights for you every single day. It wants to stay alive as much as you do, but it cannot do it alone. It needs you to listen. Start now. Don't wait for something big or scary. Don't wait until the pain forces your hand. Listen to the whispers, to the gentle nudges, to the signs that don't feel right. Trust your gut. Ask questions. Make the call. Get the test. Follow up. Because one day that choice could be the reason you wake up to another sunrise. The reason you hold your grandchild's hand. The reason your story continues. You have the power, the wisdom, the years of experience to know when something is wrong. Don't silence that wisdom. Don't second guess it. You've spent a lifetime listening to others. Now it's time to listen to you.